Hey, what's going on? Welcome back to another episode of Red Pill versus Blue Pill. My name is Dr. Delon Canterbury. I am the CEO and founder of Geriatrics, as well as the founder of the Deprescribing Accelerator. So good to see you tuning in again. We'll be discussing today how the work of our deprescribing efforts has actually kept a patient from being another healthcare statistic. So we will definitely dive into how the power of deprescribing doesn't just start with the pharmacist or doctor. It literally can be anyone asking the right questions and challenging the status quo here. So let's dig a little bit in on how you can leverage deprescribing and hopefully keep more of our seniors out of a nursing home and hopefully gracefully aging independently with beautiful fond memories of their grandbabies lying around. Okay. So, what I have noticed when I go on calls with prospective clients and they're wondering, what can I really do to really deprescribe? Am I even allowed to do this? Can I do this? Do I have to have, all types of degrees? And the power of deprescribing really starts with a dialogue. It starts with education, patient empowerment. Before you even have that, you got to have trust. You got to have empathy. You got to understand where your client or patient is coming from and how the world of medicines is just drowning them with all these pills that they have to take for the rest of their lives. And so there are tons and tons and tons of senior care providers, whether you be a social worker, PT, physical therapist, occupational therapist, again, nurse, pharmacist, clinician, prescriber. People who are touching these seniors are the ones who have as much power, or I feel should have very strong power, if they notice a medication as an issue or potentially suspected concern or side effect, then they have a role to advocate and educate and empower our patient or our caregiver. So I think a huge misconception is assuming, well, hey, it's not my responsibility, so I don't need to say anything. And that's the mindset that I feel is broken because our lovely healthcare model rewards people that are sick. We reward people who are repeat offenders to our healthcare system. And it can't all fall on the provider, okay? And here's where I believe you can have an active role. Yes, it helps to have a little bit of clinical knowledge and understanding of what these meds are doing, okay? Completely get that. That's cool. Yes, the responsibility of the patient's well-being will ultimately fall on the medical prescriber or primary care provider. Completely cool. Got that. We cannot expect all of the providers to suddenly be experts in deprescribing. We cannot expect that everyone who isn't quite the one touching the patient every day to be suddenly these experts or know when to stop. And generally, they're not going to know when to stop unless the patient is really in a place where they got to talk about the issues or they really feel, hey, I'm concerned about these falls that Julia's been having. What can we do? And then they may dive into the drugs. But the truth is, we don't think the medications do harm. And that's the problem with our healthcare system. We don't think that medications, because we're taught that we have to treat, we have to give a pill for every ill. We have to, make sure our diagnostics look good. We got to make sure we're doing something without even first questioning what the hell are these medications doing? What the hell are these medications doing, right? And a lot of times when I'm in this space and talking with patients or caregivers who are concerned, I'm giving them really the same questions that I'm asking the doctor, which is, how long have you been on it? Is it working? Is it the right dose for you? Is it the right drug for you? You don't need 4 years of pharmacy school to do that. Did I miss something? No, you just got to ask questions. And I find that a lot of our baby boomers or seniors tend to not want to rock the boat. So they don't feel as comfy asking the doc, hey, man, I must assume it's safe because they said it was safe and I've been on it for 30 years, so nothing's wrong. Nah, man. Again, that's the medication mindset. So People in the senior care space believe that, hey, it all falls on them, when really we all have separate yet unified roles to stop harmful meds in our seniors. So you don't have to be a medical doctor per se to advocate for stopping harmful meds. You just got to advocate. You just got to ask the right questions and be dogged and don't take no for an answer and really deep dive into why your loved ones may be on that. And so this is what we're going to teach clinicians who use our program: what to do, how to do it, and how to document a case where you're building it to where there's almost no reason why the doctor can't stop it. But yes, I get it. The legality will say that you have to have a medical provider's approval before stopping a med. That I get completely. This is not a campaign to just get people off of meds just because Delon said so. That's not the point here. The point is every damn drug that's been on this person's profile needs to be questioned reiteratively, quarterly, annually, until they're on as little as possible. That's the philosophy we got to start having. That's the way pharmacists can leverage their already awesome skill set into these nursing homes, into these senior care facilities, into these adult daycare centers, and start growing themselves as the experts that we already are. As we already are. So no, you don't have to take 8 to 12 years of extra schooling to become a Deprescribing Accelerator when you can do it in just 3 months with our Deprescribing Accelerator program. You don't have to spend tons of money on tuition knowing what all the drugs do like I did and still end up asking the very same damn questions, which is, how long have you been on it? Do you really need it? Is it life-sustaining? Is it required for you, the person? And how's your quality of life been since you've been on it? Is it the same? Is it worsened? Then we could probably stop. And most drugs can be stopped safely with the right supervision and the right tapering if need be. But most drugs can be discontinued, about 90% actually. And most clinical trials show that you can discontinue drugs safely with deprescribing. So these myths of I ain't the doctor, it ain't on me, if it affects your patient's quality of life, then that means they're no longer going to be able to be paying you to be in their nursing home or using your services as a home health agency. Or we're not going to need that nurse to come by because he's in the hospital. So you're not getting paid. So it does affect your bottom line. It affects all of us. But truthfully, the issue is, ethically, we should have been done this. We should have been do this. Like, we should have been reimbursed for this stuff, okay? We can't assume every medication is safe. When we know for a fact that we waste over $500 billion on side effects for hospitalized patients that aren't managed well because of those meds. We're not doing our job if I know 275,000 people will die each year because of mismanaged medications. So yes, deprescribing can absolutely keep Linda out of the nursing home and from being another healthcare statistic. If it ain't just for you or Linda, then damn it, my grandma is a perfect example. Again, given an antipsychotic in a nursing home, spiraled her dementia symptoms out of control, got kicked out of the nursing home, took 4 months for a pharmacist to finally say, hey, I think this might be the problem. That was when we had an advocate. 4 months down the road after my grandma was kicked out of a nursing home, where it was a Rite Aid pharmacist who stood up and said, you shouldn't be on an antipsychotic if you're elderly and have mild cognitive impairment. Yeah, it helps to be a pharmacist to actually call the doctor and say, hey, you got to stop. But anyone who notices a loved one taking something and finds a difference in their behaviors has a pretty high success rate of assuming it's the medication, okay? So we got to get out of our head of assuming that this old way of just let the doctor figure it out. When you are there touching that patient, when you are there seeing why they're falling, or at least have a hint of what the issue is, then it's all of us. That's why I don't believe in egos in medicine. I don't believe that you have to have an MD. You could be advocating for people and saving lives as a pharmacy technician or a medical assistant. I just need you to have a basic understanding of the drugs. But deprescribing is team-based. It starts with education for the patient. It starts with just caring a little bit more than what we do right now. And unfortunately, again, we still aren't using pharmacists to fix this at the top of our license. It's a damn shame. It's a damn shame. So there are terrible gaps in how people get reimbursed for doing these type of services. I understand that. I've been there. Those CPT codes suck. Those reimbursement rates suck. They suck. MIPS sucks for pharmacists. I can't eat off that. So we got to shift from this reactive healthcare system that's bleeding our taxpayers dry and focus on, hey, what if we spend a little bit of money to have a bigger cost avoidance on the back end? How about we use a little bit of work, a little tweak to our system, and really give that value-based care, that advocacy, that full comprehensive approach that we sorely need to move the needle on reducing 275,000 people dying each year. We can do that. And I'm showing you that deprescribing isn't a myth. It happens now. People are doing this across the world. People are doing this now. And it's sustainable. It is sustainable. And we're showing that you can track and improve quality metrics that affect your reimbursement, depending on the facility. But it affects that. So let's do it. Let's stop asking and wondering who's gonna pull the trigger. Like, no, just do it. Just do it. So unfortunately, people just don't see this as much of an issue as I do, and that's fine. You will. I mean, until it affects you or a loved one, it's gonna affect you. Okay, we have a huge over-medicating problem. It's not even just opioids, it's every damn thing. We don't need a pill for everything. So what I'm seeing is that people who are not the primary care provider, they feel powerless. They don't feel listened to. They feel as if it just falls on deaf ears, or maybe they don't have the right or the authority or the right letters after their name to speak up. And we're just teaching people to speak up and change our medication mindset and get into the world of quality outcomes that improve what grandma wants, what grandpa wants, what aligns with their holistic beliefs. And we need to look at integrative medicine to make that sustainable, apart from just the meds. Yeah, the meds are a piece of the puzzle, but still, ultimately, we got to incorporate nutrition. We got to incorporate diet and behavioral changes. And that all starts with trust. It all starts with trust. So don't feel powerless. That's why our Deprescribing Accelerator is here, to encourage and coach you and give you all the comfortable skills and tools to get you in that world where you can actively deprescribe today and learn how to do this the right way, so you're not becoming a burden to others, and have a well-documented case on why we should deprescribe. So deprescribing can lead to cost savings, cost avoidance, reduce readmission rates, improve quality metrics, quality adjusted life years. That could be a little more phantasmal in a way. It's kind of a metaphorical thing, but it's whatever. You get my point. QALYs are another important metric. Quality adjusted life years, basically having an amount of time where you are not having any type of event that causes harm to your care within that time. And that's good. That's a good thing to have. So here's how things are different when you use our program, okay? We're developing a framework where you can easily integrate pretty much any piece of our course into your current model, whether it's opioid deprescribing, whether it's deprescribing for dementia, whether it's false risk reduction, whether it is opioid, I already talked about opioids, whether you want to look at precision medicine and look at using genetic testing as a way to deprescribe, all of these can become your blueprint on how you want to monetize and leverage deprescribing for your business. So we're teaching people as you leave this course how you can create your own deprescribing workshop, how you can create deprescribing seminars, educational workshops, how you can work on providing one-on-one deprescribing services, which is also pretty awesome. And we focus on that team-based component that we know is missing. But more importantly, you understand the basics of what overprescribing looks like. You're going to get the lowdown of what having way, way, way too many meds, depending on your health condition, can be seen as, so that now you're comfortable. Now you're able to think, oh, wait, yeah, Delon said we aren't supposed to use Benadryl to help my grandma sleep because she has dementia. I didn't know that. There is so much power in knowledge and education. If you want to be the best clinician, you have to adopt a mentality where we are reducing as much harm as possible. And deprescribing is definitely that avenue that can help you with that. You will learn how to develop, if needed, collaborative practice agreements with, say, pharmacists or nurses or social workers, pretty much any entity you want. But that is an easy way to leverage some of the grant funding that's also available with deprescribing that you will take away from our accelerator program. You're going to know how to manage these challenges, and you're going to know how to keep Linda out of that nursing home so she can age gracefully and independently. And guess what? I still talk to that patient every year. I still talk to them much more frequently in the beginning, but she has sustained being off of those 36 meds and is living her happy life, aging gracefully at home with her daughter. And I'm proud to say that if I was not there to help deprescribe her from 36 meds to 8, that she would be in the nursing home. And her parents would have spent well over $250,000. Do y'all know how much it costs to be in a memory care unit? Depending on where you are geographically, it's about $8 to $16K a month. $8 to $16K a month across the US. This is sick care. So again, I implore you, it's deeper than just, oh, it's not on me, it's not my job to do this, it's not my responsibility. That's not the way healthcare was intended. Clearly the system's already messed up, but we're going to do something different, and we're going to show you the way that you can do this and give that extra advocacy and empowerment that's going to set you apart from the other clinicians. Value-based care is not going away. So you can keep someone at the nursing home as well. Yeah, it helped that I knew some of the clinical stuff, the medicines, I knew some of the interactions here and there. That's going to always help. I'm a pharmacist. I get that. But a lot of it started because the caregiver was concerned. The caregiver asked questions. The caregiver saw, this is too many meds. Simple and plain. The caregiver saw, this is way too many meds. I see a difference in her. What can we do about it? And I am just a cog in the wheel, but ultimately, if that caregiver didn't advocate, I know for a fact that patient would be in a memory care unit. So how do you want to leverage deprescribing? What do you want to do? How do you want to put this into your practice? How do you want to keep someone from living independently at home and gracefully? Set up a call with us. Let us know. I want to know your thoughts. I want to know, how do you want to leverage deprescribing? Apply and join it in our next cohort. The link is below. Geriatrics.as.me under Deprescribing Accelerator. I want to know and learn how you're going to make this movement continue in deprescribing. So you guys take care. Much love, much respect. We'll have another one tomorrow, and we'll talk more about the power of deprescribing. But I hope you guys enjoy your week. And until next time, your chief deprescriber. The Law in Canterbury is out. Take care.